Hi, my name is Casey Triple, nurse practitioner with Cardiology HCA. We're going to start putting in pacemakers here, so I'm here to just give you a little bit of education about post-op care. So Dr. Brown, he will be the physician putting in the pacemaker. Whenever we do it, they'll come out from PACU to you with this arm brace on. They get just constant sedation, so usually by the time they come up from PACU, they're pretty alert and oriented. We just do routine post-op vitals, so the Q15x4, Q30x2, and then 1. I just do vascular checks on the arm that's in the restraint just to make sure that their arm is still doing good. With the brace, it'll just be around their chest like this. They'll have their arm immobilized, but they can still use their lower arm to do all their normal activities. This brace stays on for 24 hours post-op. If they are pretty significantly confused, we'll go ahead and leave it on. They will come up with the incision in their upper chest area here, and it will be closed with glue. There are usually no external stitches to it. We tell people that they can shower as long as they don't move their arm above their shoulder area. Soap and water can run down, and then when they get out, they just pat it dry. Over time, we say just let the glue fall off instead of picking it off. We don't want them to open it. During the time that they're here, we just kind of educate them on making sure that they're not lifting anything above 5 pounds, pushing or pulling. For the first week when they go home, they do not have to wear the brace during the day as long as they remember not to lift their arm up above their shoulder. We do tell them that they have to sleep in it for 4 weeks. They will come for a 1-week wound check afterwards. If they're on any blood thinners, we hold that until their 1-week wound check. Let's see here. The biggest thing to watch for in the morning is like any shortness of breath, decreased oxygen level, because we keep them overnight just to make sure that they don't get a pneumothorax. First thing in the morning, we'll do a chest x-ray. Then the device rep will come in the morning just to make sure that the device is functioning properly. As long as everything is normal with that, they'll get to go home that day. We do give them this instruction sheet that will have their 1-week appointment on it, and then their 3-month appointment that has their device check on it. It's also going to have all of those instructions that I just went over about, you know, how long to wear the brace, what to do with the arm, no heavy lifting, looking for signs of infection to their incision site. It has our office phone number to call if they have any questions. Here's kind of some samples of what the pacemakers will look like, and we will show patients this usually before their procedure.
How do we treat for pain?
Pain, we usually will start with just Tylenol. Usually there is not a lot of pain. They might complain of discomfort, but if they have ongoing pain, even with Tylenol, you're more than welcome to reach out to me or Dr. Brown, and we can get you some more pain medication if needed. Anything else you can think of?
That sounds good.
Alrighty, well, if you guys have any questions or concerns, I know the secretaries and the charge nurses have my cell phone number. I will also round first thing in the morning after their pacemaker, and I will come up with them from the PACU just while we first start this to make sure that you guys feel comfortable.
Thank you.
You're welcome.